It was in 2002 that I became the CEO of one of Canada's largest academic hospitals. A hospital that treats the most sick of patients, the sickest of the sick. It's a hospital where you should also expect the latest technology and treatment protocols inspired by research and discovery. And by April 2007, we were widely recognized as one of Canada's top leading academic hospitals. But in our relentless pursuit of technology and discovery, all of it focused on better patient care and saving lives, we somehow lost our way. And on July 31st, 2007, I discovered just how lost we were. I wish I could say it came to me after quiet reflection or keen observation, or through complex data analytics on patient outcome metrics. No, this realization or epiphany did not come to me gently over time. It hit me like a punch in the gut when I least expected it from someone I didn't even know. Someone with no medical background, no fancy credentials, from the words of a complete stranger in a letter addressed to me from a man named Blair. How can you, the letter reads, how can you justify a healthcare system that puts less emphasis on the comfort of a human being than our society demands for animals? Blair is the husband of an elderly lady who had the misfortune of falling at their cottage on a Friday afternoon in July. She fractured her left hip and wrist and was in need of surgical repair. In his letter, Blair describes the frustration and anxiety that they felt in the 48-hour period while they waited for surgery. No one seemed to be interested in their concerns, and no one seemed to want to respond to their questions. In his letter, he asks, why can't staff be upfront and explain the real situation and not try to cover up the inadequacies of our healthcare system? You see, Blair understood there was a wait time. He just didn't understand why no one seemed to care. He ends the letter. My overall impression of the operations of your hospital was of an inefficient, disjointed system on the verge of sliding into uncontrolled chaos. It's hard, even today, several years later, to fully express what that letter and those words did to me. They shook me to the core. What I had seen as a remarkable evolution into a top academic hospital had to be considered now a failure. After spending years rebuilding and rebanding the hospital, a single patient and her husband showed me that we had lost our way. In our world of new technologies and discovery, we had become very good at caring for patients, not so good at caring about them. From that moment on, this letter would become the letter that changed the face of the Ottawa Hospital, the letter that changed everything. What was it? What was it, I asked myself, about this case that we did not see? In fact, we did not feel her pain, her worry, her fear. So I reviewed her case personally. She had her surgery within the 48-hour wait time target. Check. She received a state-of-the-art hip prosthesis. Check. And her surgeon, one of the best, used the latest surgical techniques to minimize complications and hasten recovery. Check. And her new hip joint? Well, that would be better than the original. Check. She received 21st century healthcare. So how is it that a patient can receive 21st century healthcare and have such a bad experience? The answer was obvious. We were measuring our performance through the lens of a healthcare provider, not through the lens or eyes of a patient or family member. We treated this patient's injuries successfully, but we failed to do so with compassion because we saw her as a case, not a person. We saw her injury, not her pain. We saw our role within the narrow confines of technology and technique. We equated care and compassion with medical excellence alone. We were focused on fixing her fractures as if somehow they were disconnected from her emotional state. We failed this patient and her family because we lacked empathy. And so I reframed the question. How would this letter have been different if instead of a case, we saw a frightened lady in great pain? What if someone felt this woman's pain, felt this family's concern for someone they love? What if it was your wife, your mother, or your sister? What if the patient was someone that you loved? And for me, ladies and gentlemen, that is the question that changes the conversation completely. We changed our hospital's vision statement and made the patient our focal point. Our vision is to provide each patient with the world-class care, exceptional service, and compassion that we would want for a loved one. That we would want for a loved one speaks to each and every member of our staff and makes it personal. It makes empathy a part of everything we do. It means putting ourselves or a loved one in another person's position, if only for a moment, to feel their fear, feel their pain. Now, some of you are probably thinking, healthcare professionals, doctors, nurses, and others, have to keep a certain distance or objectivity in the best interests of their patients. And I get it. You really don't want a highly emotional surgeon. You want a really good one. But I believe that when healthcare professionals make empathy part of every patient encounter, not to stay there, but to set the course, they begin in the right way, in the right place, in a human encounter before the professional journey begins. So, what does empathy look like in a very large academic hospital? Actually, it's quite simple. It's doing the big things and the little things really well. Robotic surgery is a big thing. Less pain, less time in hospital, faster recovery. A cyber knife removes tumors that a short time ago were deemed inoperable, without an incision and no scar. It's a big thing when you're really, really sick and you receive the latest treatment protocols, the best in the world. And for those patients who unfortunately have been told that conventional therapy no longer works, it's a really big thing when they're offered the gift of time and hope through research and discovery. These are just some of the big things you should expect at an academic hospital. But no matter how impressive the big things are, it's the little things that often make the difference. I have received thousands of letters over several years, most good, some bad. Patients and families really do understand the limitations of our healthcare system, and they never question the skills or competence of their healthcare professionals. Every single letter I receive, good or bad, speaks to the attitude and behavior of our staff. At our cancer center, where patients receive the most difficult diagnosis and the most frightening treatment protocols, they speak of warm smiles and friendly faces as being important to them. Empathy in action. Patients are comforted when our nurses smile, call them by name, and introduce themselves. And at the end of shift, when they do the report with the patient at the bedside. Turning down the lights and reducing the noise by speaking quietly at night is greatly appreciated by our patients. I could go on, but I think you get the point. It's the little acts of kindness that make a world of difference to our patients. Now, don't get me wrong. Empathy alone will not cure all that ails our healthcare system. But my message today is that empathy is a critical component to the larger, more complex equation that defines 21st century healthcare. We must continue to invest in state-of-the-art equipment, the latest technology, and research that makes a difference. But I believe the true benefit of 21st century healthcare is realized only if we also recommit to the human dimension that is the cornerstone of our profession. Because when patients come to us, they are at their worst. We must be at our best. And when we no longer see a stranger, but to see the face of a frightened human being, or perhaps a loved one, in the patients we serve, we are at our best. So, to me, Blair is the real author of what I like to call the empathy imperative at our hospital. His legacy is a better patient experience at our hospital because we've committed to bring empathy into 21st century healthcare. And I can say with confidence that today we are better. And in fact, I can say confidently because I received a letter 5 years after Blair's from a man named Conrad. Conrad's father was rushed by ambulance to our emergency room, paralyzed and comatose. He had suffered a massive stroke. He was treated by one of the best stroke teams in the country, using up-to-date treatment protocols, latest drugs, and state-of-the-art equipment and technology. And after several days in hospital, I am pleased to say that he went home with a full recovery. So I'd like to close by giving Conrad the last word, because he brings this discussion full circle. Dear Dr. Kitts, I am writing because I had the recent, unfortunate pleasure of interacting with your wonderful teams at your hospital. From entry to discharge, my wife, a registered nurse herself, and I were extremely impressed with the responsiveness, the level of care, and the professionalism of all your staff. And although Conrad's father-in-law received the best medical treatment by some of the best healthcare professionals in the world, it was one of our transportation workers, a porter, that had the highest impact on his patient experience. You see, after noticing that the patient was cold, the porter grabbed a warm blanket and gently covered him. The letter continues. Even though he had had a rough few days, the purr and facial expression on my father-in-law was absolutely priceless. And I honestly think that those 5 seconds of bliss made a world of difference to him. Please do not be insulted when I say we hope not to ever see you again. But if we do, we know we are in good hands. thank you for treating us as one of your own. And that, ladies and gentlemen, is what the empathy imperative is all about. Thank you.